Hi guys, I'm back again. We're going to just talk a little bit about our last series, will be conflict. I appreciate all of your patience as I'm trying to get this to upload on our rural bandwidth and our internet. You'll see that I did post a simulation for all of you to look at on Blackboard that was actually a really good actual scenario of some conflict that occurred between a charge nurse and a staff nurse, and how at first it was handled inappropriately and how they then moved to coming to some conflict resolution. So take a look at that. You'll get past the hair. You'll know what I'm talking about once you watch the simulation. So actually it has some good key concepts that it highlights. So when we talk about conflict management, we know that there's lots of causes of conflict. You can have interpersonal, interpersonal, and intergroup. So that's, conflict within yourself, conflict that occurs amongst nurses, patients, family members within the healthcare team, or if you have large groups that are having conflict. So we all know that organizational conflict really can disrupt working relationships, and it creates an atmosphere that is not actually ideal to be an employee with. So you can see you'll experience hopefully a more positive environment where you choose to work. But there'll be times that you might work where there's a lot of conflict, and when you come to work, it's like walking on eggshells, and it's like, okay, I'm not really sure what's causing this conflict, but sometimes one of the things that can lead us to early burnout is having this organizational conflict that we can't resolve. So most conflict, again, let's talk about, it goes back to good communication. So most often caused by ineffective communication, unclear expectations, poorly defined structures, or not giving good, clear expectations. People that just don't, that might be incompatible. Remember, you're going to work with a lot of people that you may not like or you may not choose to have in your own social circle, but you still have to learn how to work with them as colleagues and, again, maintaining the best patient care that you can. Management and staffing changes. A new manager can change the whole dynamics of a unit. Also, new staff can change the whole dynamics of a nursing unit. So when we look at conflict management, we're actually looking back at the problem-solving process, identifying the problem, discussing possible solutions, analyzing, selecting a solution, implementing them, evaluating that. Look, what does it look like? It looks just like the scientific process, and it looks like the nursing process, except we actually identify the problem first. So, and then we come up with solutions. And just so you all know, I have my Tim Hortons. I did make my Tim Hortons run before I did this. So you'll be glad to know that I'm still getting my daily fix. So a couple conflict management strategies. This is not something I want you to memorize at all. If I told you in the priority of life, this is not to memorize. This is just to know that there are some different strategies that actually do well when we're trying to manage conflict. And there's things that are not, it doesn't actually deal with the conflict. Might deal with it right at that time, but actually doesn't deal with it overall. So there's a couple different strategies. There's avoiding and withdrawing, smoothing it over, competing or coercing, cooperating or accommodating, or compromising or negotiation. And you can read what all of those outcomes of each of those styles are. I really kind of like this graph. It really puts it into a nice way of looking that if you're looking at conflict strategies, you look at two areas. Is there a low concern for relationships or a high concern for relationships? Or is there a low concern for outcomes or a high concern for outcomes? So you can see that these different types of conflict strategies will fall in different areas. So, for example, if I use avoidance as a conflict management strategy, that's really a lose-lose for each party on either side of the conflict. It really, as you can see, there's a low concern for relationships and there's a really low concern for outcomes. This is the person who withdraws from the situation, tries to remain neutral, delays responding to conflict. So avoidance really isn't one of the best management strategies for conflict. You'll see that one of the better ones, one that has a high concern for relationships and one that has a high concern for outcomes, is the collaborator, the problem solver. They're assertive, not aggressive, but assertive and cooperative. They objectively evaluate different views, and this can lead to creativity and new ideas. So, and you'll see over here with the accommodation, the peacemaker, if you know that you fall into one of these pieces, this is one that I'm really concerned about. Is everybody going to like me? Is all the relationships going to do well? But I'm not really looking at what is the outcome. What is my concern for the outcome? So just know there's many different ways that we deal with conflict strategies. Not one strategy works in every single situation. This is just like leadership styles. And everyone has their own particular conflict management strategy. All of you already know at this point, are you somebody who avoids things? Are you somebody who gets very aggressive? Are you somebody who wants to collaborate and come up with a win-win situation? So there's many different ways to go about conflict management. And if we appropriately manage it, it can help us understand the responsibilities of each of our roles within the healthcare team. Just a little bit about a grievance. You'll hear more about grievances in a union environment, but this is where the employee feels that they've had some unfair treatment that's be considered grounds for a formal complaint, and cannot be satisfactorily resolved between the parties and need a third party involvement. Actually, interestingly enough, the first day of my husband and I working together in the same dining room, he turned me into our union. I'm not really sure who the union is that represents both of us, but he said I'm a little bit of a general. You guys will be very shocked at that because you know I'm nothing like that. But that's really what a grievance is. And all healthcare facilities also have should have some formal grievance policies established that really can help you if you are unable to negotiate that conflict amongst two people. So again, another great method for resolving conflict is through collaboration. So think of some examples of, and this might not be because you might not have worked in healthcare, but if you do work in healthcare, think of some things that you've used collaboration for and it's resulted in a positive conflict management outcome. Now, when we talk about the appropriate communication style to use during negotiation or conflict management, really we're looking at assertive communication. Really is necessary during conflict resolution. It allows you to be direct, honest, non-threatening. It's not going to infringe upon the rights of others. It really is a way to deal with conflicts. It recognizes others equals. And really, this is what we talk about when we say providing a direct statement of feelings. Instead of saying you say I feel, I understand, this is my interpretation. So again, very, very different than aggressive communication, okay? So again, personality types. Every one of us in this room or on our virtual Zoom meeting here have a different type of personality. And this will tend to really contribute to workplace and personal conflict or lack thereof. So key concept here, I would make sure I knew this. Whenever we're dealing with conflict, We focus on dealing with the issues, not the behavior. Again, important concept. We focus on dealing with the issues, not the behavior. Now, couple different personality styles. Like I said, everybody has a little bit of different personalities. I like to characterize this into 3 different groups. We've got tanks, we've got snipers, we've got the clams. Those tanks, exactly what I'm talking about, one of them big military tanks. That type of personality, they like to intend to gain control over others. Okay? Management strategies for dealing with somebody who has this type of personality. You want to deal or contend on equal terms. If you feel that you are being treated poorly, you really don't want to accept this behavior or excuse it. And you're not going to change this personality, but you want to alter their behavior towards you. So tanks can be sometimes difficult to deal with. Snipers. These are those ones exactly like I'm showing you in the picture. They are the ones that sometimes don't say much, but when they do, their digs, employee hurtful teasing, techniques for handling this. Sometimes you have to kind of get group confirmation or denial, not trying to get a group together to say, yes, we need to exclude or exclude this person, but really just to make sure that you are actually, this is what you're seeing. Again, early problem solving with this person is very, very important. Now, clams. These are the ones that are the most, I think sometimes are even more difficult. They don't respond. This is how they handle uncomfortable situations. This is actually their coping mechanism to handle conflict. It makes them feel safe. It masks fear and anger. It could be very cultural based. Now with clams, with those personalities, you have to ask open-ended questions to get them to maybe speak, let you know their feelings. You want to be friendly, use an expectant, quizzical expression. This is something I have a hard time with because I like to talk, shocker, but we don't want to fill that empty spaces of silence. We actually want to listen because when they start talking, they will open up. But if we keep talking, we're never going to give them the opportunity to start talking. So a couple practice questions that go along with conflict management. We have a nurse who's caring for a client needs to carry out an order for a dressing change on a wound that has dehisced. The doctor has ordered the dressing to be done every shift. The client has had visitors all day and has been refusing to allow the nurse to complete the dressing change. Which of the following actions by the nurse would be most appropriate to use initially? Okay, so if we look at all of these options, 1, 2, 3, and 4, I'm hoping that you guys are all leaning to answer 2, okay? Explaining the need for the dressing change and negotiation when it can be done, okay? So again, we don't want to be overly assertive. We're not going to delegate and move it to the next shift because that's how things get moved from shift to shift, and then 3 days goes by and no dressing change ever has gotten done. You could invite the visitors to stay, but maybe the patient doesn't want them to be present. So the best thing is negotiation. Negotiation is an important to help meet your needs and also work within your time management, delegation, and prioritization schedules. Okay, question number 2, select which of the following behaviors are representative of proper execution of assertive behavior. So this is a select all that apply. So, true or false for each of these different distractors. The focus is on the conflict or the issue. True. Empathetic statements are used. True. The individual is confronted in a public location. False. If you ever are dealing with conflict, you want to take them into private location. Okay, so if you're trying to, you're having conflict with your assistive personnel or your LPN or another RN, you want to pull them and handle it first directly, peer-to-peer or from RN to LPN, RN to nurse's aide, but you want to do it in private and also get, in a non-threatening manner, get their interpretation of what has occurred. Direct statements of feelings are made. That would be true. Eye contact is maintained. That is true. And sometimes it's hard when you're dealing with conflict and you're having that uncomfortable communication. You really want, that will really help show that you are actually interested and available to listen and discuss the issues. Avoid using you statements that can indicate blame. That is true. Okay. And again, do we want to establish trust? Absolutely. Trust is the foundation of all of our principles. Okay. True or false? Variation in ages of healthcare team members can create organizational conflict. We talked about the generations about 2 weeks ago, and that alone, we know that this is true. That whole difference in generations can be one cause alone of the conflict that we see in healthcare. So that was our highlights on conflict management. Next thing is just a few minutes about reality shock. Okay. This was really going to be the whole focus of our graduate nurse luncheon for when we brought back some of our previous graduates that had just graduated last year, some that had graduated 5 years ago, just to really give you some insight that this really is a process that all of you, or a series of events that many of you are going to go through. It's actually researched, it's studied, and it's that transition from nursing school to RN. Because what happens in nursing school is you get frequent positive reinforcement. As much as all of you are ready to probably get rid of us on a daily basis as instructors, we really try to keep you motivated, give lots of positive reinforcement. We do a lot of attempts to communicate. We do a lot of attempts to clarify. We try to the best of our ability to be available to you as you go through the nursing program, as you navigate through school. And unfortunately, once you transition to a registered nurse, you're going to have a preceptor, you're going to meet colleagues, you're going to have people that you have identified as mentors that maybe aren't your preceptor that you were assigned to. But it's going to be very different than what you've experienced in the school setting. So you're going to have some role image, what the nurse should be, the perceived role image, what the definition of the role or graduate with this role, and then the performed role image, what the practitioner actually does. So again, you're going to see every one of you are going to go out there and go, well, that's not what I learned in school, or that's a shortcut, or this is not how I was taught how to do these things. Remember, there's many different ways to get from point A to point B, and sometimes I say, what are my two biggest things? If you are not jeopardizing patient safety and you are not violating medical asepsis, these things may be okay, But again, you never want to jeopardize any patient safety, your license, and what you've worked so hard to do. So again, reality shock really just kind of occurs when you have the ideal or perceived role comes into conflict from what you learned in school. Okay, so you get some anxiety. You're not really sure how to feel about it. And if you don't get it under control, this can lead to burnout. Or 100 phone calls to me or Facebook messengers at 3 in the AM saying, help, why did I go into? Some of the positives about reality shock is, honestly, this is going to be the most interesting role transition of your life. And you'll never forget when you graduated. You graduated in the middle of a global pandemic. So you guys have or will graduate in a very historical time in history. So this is going to be one of the most interesting roles. You are going to have the honeymoon period. It doesn't last, but you will survive. This is when you first start getting your checks. Things are good. Everything's fine. You're still with a preceptor. You have assistants. You have help. Then you go through this, oh my God, what the hell just happened to me? You go through that shock and rejection, but then you recover, okay? And you're like, okay, I got this. Everybody goes through it in different time frames, but it is normal. It is to be expected. So again, be part of the solution, not part of the problem. Know your own abilities. Prepare for the real world post-graduation. Have realistic expectations. So keep going. You need supportive resources. Talk. We are always here for you. Know ahead of time, there's going to be great days. There's going to be bad days. You find a mentor. And again, like I said, that mentor might not be the person that you've been assigned as your preceptor. It might be somebody that you meet on your shift that you know, that person that you just really hit it off with. You communicate well. You go to them when you have questions. You go to them when you have you need support. So a lot of times those mentors are not the ones that are selected for you. Many of us pick our own mentors by who we click with and who gives us, and we give them the support, and you kind of build that relationship. Don't forget about burnout. I don't want to be negative, but some of the signs of burnout is, again, especially if you have a lot of accumulative stress, work, personal, family, you become emotionally exhausted. Now, interestingly enough, some of the common candidates for burnout are students or our workers that are very intelligent, they're hardworking, they're idealistic, they're perfectionists. Now, does that sound like anyone in our class? Absolutely. So you have to give yourself a pass. You have to be realistic. You have to take a deep breath. And you picked a career that truly, if you have even had the news on it all for a couple minutes today, you don't go 2 minutes without hearing about nurses and healthcare workers and physicians. It's a high performance. It has high expectations, highly controlling. There's a lot that goes into this profession. So how you're going to prevent burnout is recognition. And the better part about nursing is sometimes you have to make a change. And how many areas can you go into in nursing? Millions. Now again, this is not in October when you get through that honeymoon phase and you call me and say, oh my God, why did you let me go into nursing? This sucks. This is hard. I'm exhausted. But this is down the road. If you know, hey, this maybe isn't the area of nursing I want to be in. You will find your niche. You will find what you love. And that can be many different things, and there is nothing wrong with it.